So for our first test, you're going to need a piece of doweling. If you don't have doweling, but you have a mop or a broom, you could take the handle of the mop and the broom and use that as your dowel instead. So we are measuring shoulder flexion first. So you're going to sit on the floor and you're going to scoot yourself back so your back is against the wall. You're going to sit in cross-legged. If possible. If you cannot sit in cross-legged, then that is a note that we need to work on your hip mobility, and you could just come into feet on the floor if absolutely necessary, but as much as possible, we would like you in this cross-leg position. So remember, the action of flexion is the ability to take our arms overhead. So you're firstly going to get yourself set up so the back of the pelvis is against the wall and your shoulders are against the wall and the back of your head is against the wall. Then from there, you're going to hold the PVC pipe at shoulder width apart. So it's really important that you follow these guidelines to perform the test correctly so we get accurate results. So now simply all we're going to do is lift our arms, straight arms, so make sure that you're not bending the elbows, and you're also keeping the wrists nice and fixed. So you're not letting the wrist go back, and you're going to go back as far as you feel that you can, keeping those contact points against the wall. So the ideal position is that you can get the arms and the back of the hands against the wall without letting your wrists go back and with your elbows straight. So if you can do that quite comfortably, then you're going to score yourself a 3. Some compensations that can occur though, so you think that you're doing it correctly. However, if you looked at your spine, what happens is that people's rib cage starts to flare and they're actually arching in their back to allow them to get into that position. So you're making up for the lack of the range of motion through thoracic extension, moving that mid-back further back rather than the shoulders. So to truly score a 3 on this test, you have to make sure that you're keeping those ribs down, the shoulders in contact, shoulders and shoulder blades in contact with the wall, the back of the pelvis in contact with the wall, and that you are not doing any compensations through the body or through the elbows or the wrists. So maybe go ahead and try that one more time, thinking about all those points, and then see whether you truly score a 3. So I did not score a 3 because I could not get my arms at ease against the wall without compensating. I could get them back against the wall if I let my ribs flare, if I let my wrists go back, and if I slightly bend my elbows. So this is telling me I have some restrictions in my shoulder ability to flex the shoulder, my shoulder flexion. You would score yourself a 2, so I'm going to score myself a 2. I can touch the wall, but I have to do some form of compensation. You would score yourself a 1 if maybe you can get back there, but you have a lot of discomfort. So without compensations, but you have a lot of discomfort. Maybe you're having to hold your breath because it's so hard to get into that position. Or maybe you have some slight pain in that position. So anything painful we don't really want to do. So you'd want to indicate on your sheet that this position causes shoulder pain. And if so, if it's in the right shoulder or the left shoulder. Another thing that you might find is that maybe one side can go back nice and easily and then the other side feels more stuck. So that could be another thing that you could mark on your scoring sheet. And you would give yourself a 0 if you were not able to get into the position at all. So I hope that makes sense. So give it another go, score yourself 0 through to 3, depending on where you are at with this motion. So we did shoulder flexion with our palms facing backwards. Well, sometimes we do pull-ups, or you would call them chin-ups, with your palms facing up. So let's have a look at what the difference might be in your flexibility with palms facing up. So hands are shoulder width apart again, elbows are locked out, wrists are nice and fixed, they're not dropping down into extension, they're nice and straight. And then you're going to drive your arms overhead and see if you can get your hands against and arms against the wall. A, without discomfort, B, without compensation, and with nice ease. So if you can do that, good for you. You would score yourself a big 3. If you could do it with some compensation, you would score yourself a 2. And if you have got compensatory things, write those down on your sheet. Could do it, but back came away from the wall, or could do it, but wrists cocked back. So make yourself a note, because you'll see maybe how those things change over time. You would give yourself a 2 if you could get there, but there was some pain or discomfort from excessively trying to get into that position. And then you would give yourself a 0 if you weren't able to get into that position at all. So I will be doing a separate video to tell you how to interpret your results. So basically what it's telling us, if we are tight, if we are restricted with our palms facing up, then it's telling me something about the flexibility you have in through your lats. So our lats are gonna, if they're tight, prevent us from getting our arms overhead and turning our arms into internal rotation. If you are tight the other way with the palms facing forward and knuckles back, it's telling me a little bit about the flexibility you have in the back of the shoulder, at the posterior shoulder. And there are things that you can do to help make these things better. So it's good to have this starting point. So you're going to have a score from 0 to 3 on these 2 movements of shoulder flexion, one with palms down and one with palms up.